Just an overview. You seeing that?
Yes.
Yes. That is what we call the implanon. You getting it?
Yes.
Yeah.
That is an implanon. Then we also have the coil. That is what we call copper T. Yeah. Then here we also have the copper Y. That is what we call copper T. Yeah. The copper Y, there we have it. Then we have the jadel. That is the jadel. And the applicator. That is its applicator. Then we also have the Sayana press. Previously, it used to be known as Depo, but the packaging has changed. Now it is Sayana press. The 3 months injection. We have what we know, it's known as condom. That one. I'm sure everybody is familiar with it. Then the pills, of course. We have 2 types, but they're all microgynon pills. That one and this one. Okay. Yeah. So generally, that is what family planning entails, as in with the items. But we normally have also the permanent methods. So these ones we have the chemical ones, but we have also the permanent methods, whereby it's both applicable to the male and the female. Okay. Yeah. So just give me a minute so that I can open my notes. Yeah. Family planning, actually, it's a method of child spacing. Am I clear? Hello?
Yes, you are. I've actually muted people.
Okay. Thank you. Yeah, family planning is a method of child spacing. Actually, it can be natural or artificial, but it's a way you can space the children in your family. In short, it's getting children by choice and not by chance. By chance, I mean accidentally. But by choice, it means both of the partners are in agreement. They have agreed upon getting this child and they have planned to get this child. So, the importance of contraception, family planning empowers people's rights to determine the number of spacing of their children. It also prevents deaths of mothers and children by preventing unintended pregnancy. Some family planning methods, such as condoms, can help prevention of transmission of infections, like, for example, the HIV and the STIs. We also have the family planning reducing the need for abortion, because when you come for abortion, that means you got that pregnancy by chance, not by choice. And yet we are talking of family planning by choice, not by chance. And then when it comes to the economical benefit, of course, it delays the delay of fast pregnancy. Child spacing allows women to complete education and further careers. Yeah. When, for example, maybe you got a child by accident in the first place. So when you decide, maybe you are not oriented in terms of family planning, But when you come across family planning, somebody enlightens you, and then you are aware of the family planning, then you will be able to space the other coming babies. And in that manner, you'll be able, if you are somebody who is still pursuing your career, you'll be able to pursue your careers. You are able to complete your education. That is what I mean by economic benefits. And then uh, we have the unmet need for contraception in Kenya. That is the percentage of women currently married or in union who desire to either terminate or postpone childbearing, but who are not currently using a contraceptive methods. That is A, those with unmet need for limiting, those with unmet need for spacing. Women with an unmet need for limiting are those who desire not to have additional babies. But women with an unmet need for spacing are those who desire to postpone their next birth by a specific length of time. Okay? And then the reasons for the unmet need for contraceptive could be the limited choice of methods. We also have limited access of contraception, particularly among the young people or even the poor segment of population or the unmarried people. Most of them, they tend to fear to approach a health facility because they imagine, what will people think of me going for a contraceptive? But actually, you're supposed to be enlightened. You're supposed to be empowered by you going to access, by you accessing this contraception. It means you are now enlightened. You are empowered to access those services. So do not fear to access the services as long as you know you're doing it in the right way. Then experience of side effects. There are also the myths and the misconceptions, as I've come across some clients, and even some of the questions that I've also seen about cancer, being that contraception causes cancer. That is a myth, which I'll discuss later. Then we also have cultural and religious oppositions. We also have poor quality of available resources, and the user and provider's biasness, in that, for example, when the user comes in, and then me being a service provider, when I'm expected to provide the service, I'll look at you and I'll say, no, you are a child, so I'll not give you. And yet you are a client, you've come in for those rights, so I won't be biased. Instead, I'll offer the services if at all they're okay with you, and if at all they are within the requirements of your, for example, your health status. Yeah. And then we also have gender-based barriers, that is male partner influence. For example, I can just give an example of the IUCD. Most clients are complaining that their partners are against those family planning methods like the IUCDs because they feel in our dunga dunga. But we'll discuss that later. Okay? Then we go straight to the classification of contraceptive methods. And then the classification, under the classification, we have the spacing methods, and then we have the terminal methods. Under spacing methods are the ones that I've shown you, but the terminal methods, these are the permanent methods, in that we have the male sterilization and the female sterilization. The male sterilization is called vasectomy, and the female sterilization is called tubal ligation. And then with the child spacing methods, we have barrier methods, intrauterine devices, hormonal methods, and post-conceptive methods. So in Kenya, we have, I can quote the percentages. whereby as per the methods that are being used, the current data that we have is that with sterilization, we are at 2.6%. Condom use, we are at 5.2. With IUCD, we are at 6.5. With pills, we are at 12.2. Implants, 18.3. Injectables, we are at 50.2. Injectables are the ones like Depo. And then emergency contraceptions, we have 3%. And other miscellaneous methods, we have 0.5. Straight, we'll go into the progestin only pills, the injection, and the implants. So we are under the progesterone only pills, injection, and the implants, we have the pros and the cons. With pros, we have injection and implants. They are very effective. They may be used while breastfeeding. Yeah. And then fewer or no periods. They can also be used to reduce bleeding and cramping with periods, which lowers the risk of anemia. There is also reduced risk of pelvic inflammatory disease. It can be used by women who cannot take estrogen. It can also be used for protection against endometrial and ovarian cancer. I hope that point is very clear enough. Protection against endometrial and ovarian cancer. And then under the pros and cons, under the cons, it causes more irregular periods or spotting between periods. That is to some clients. Then progesterone-only pills are less effective than combination pills. Then we have implant must be inserted and removed by only a health practitioner who is trained. Injection may delay return of normal cycles for 6 to 8 months stopping. And then injection can also cause weight gain, and it's either way. It can cause weight gain or it can cause weight loss. We also have prolonged injection can cause bone loss, which may not be fully reversible after stopping. Then we have under the combined oral contraceptives. Currently, I know they're introducing the patch, but we don't have it in our facility. We don't have it, but patch is there, and then also the vaginal rings. So with pros on those three, we have reduced bleeding and cramping with periods, which lowers the risk of anemia. We also have fewer or no periods with certain type of pills, that is. We also have reduced risk of PID, that is pelvic inflammatory disease. It may also reduce acne, and then it may also reduce ovarian cysts. It may also reduce symptoms of endometriosis. It can also protect against ovarian and endometrial cancer. So you see on this side, it's more advantageous. In fact, it does not cause, but it prevents. Then on cons, does not protect against STI or HIV, may not be as effective when taken with certain drugs. That is, I can give an example, like for example, the anti-TBs. The anti-TBs, you don't combine with any hormonal family planning, otherwise you get pregnant. Then pills must be taken every day. With a patch, it reduced protection if exposed to direct sun or heat, can release high dose of hormone from the patch, which leaves less for the patch to release later in the week. And then you can end up getting pregnant. Then patches also deliver more estrogen than low-dose birth control pills. When women using patch may be more likely to get blood clots. Then when we move to the intrauterine devices, that is the IUCDs, we have the pros, whereby more than 99% effective in preventing the pregnancy. It can be used as an emergency contraception. Most most cost-effective method of birth control over time. Then we also have safe use while breastfeeding, and that is because it's non-hormonal. And then fertility returns with the first ovulation cycle following the IUCD removal. It can be inserted after a normal vaginal delivery or a cesarean section, or even if you have procured an abortion. Then we have hormonal IUD can also relieve heavy menstrual bleeding and cramping. When we move to the cons, we find that it does not provide protection against STIs or HIV. And then another thing is that only a health professional is allowed to insert it, and the same health professional is allowed to remove it. You cannot go to any quack unless you are trained. That is when you are allowed to insert and remove. Then when inserted, an IUD can spread an active genital infection into the uterus, leading to endometriosis in the first months after insertion. That is why you find most people after insertion, if not taken good care of, they end up coming with complications. And these complications may be infections, and it might, if it worsens completely, if not treated in time, it can even cause PID, and it can even cause some serious interventions which can affect you in the future. Then with barrier methods, we can move now to the barrier methods. The barrier methods are the male and the female condoms. And then how it works, it forms a barrier to prevent the egg sperm, the eggs and the egg and the sperm from mating. And then the effectiveness is that it's 98% if correctly used. If correctly used and consistently used, that is 98%. But 85 if just as commonly used. With female condom, we have 90% with correct and consistent use, 79% as just commonly used. I hope we are getting somewhere with that. And then under the permanent method, the one that I mentioned before, we have the male sterilization, that is vasectomy. And then we also have the female sterilization, which is tubal ligation. Under the permanent, the vasectomy, it's a permanent contraception to stop or cut the vast different tubes that carry sperm from the testicles. It works by keeping the sperm out of ejaculated semen. And then the effectiveness is more than 99% after 3 months semen ejaculation. Then when it comes to the female tubal ligation, it's a permanent contraception to block or cut the fallopian tubes. The eggs are blocked from meeting the sperm, and the effectiveness is 99%. So, in short, I can say that that is just the general overview of family planning. And then maybe before I may go to questions, how the family planning works. The family planning works in that, first of all, it creates a mucus plug, thick mucus plug on the cervix that can block the entry of the sperm into the uterine cavity. And then it can also work by preventing ovulation in that it blocks the release of the egg, that is the ovum, for fertilization. So this means this egg won't be released and ovulation will not take place. And then when it comes to now the walls of the uterus, it acts by thinning the walls of the uterus and making it unfavorable for implantation. Yeah? Up to there. Maybe if I can welcome now the questions.
Sheila, we can also start by taking maybe the questions
Yes.
as they type the fresh questions.
Yes.
You can start with the questions that I had sent early.
Yeah.
Yes.
Let me just check on my profile.
Okay, if you don't have them, I can read them for you.
Please do.
Okay. So is there something like non-hormonal contraceptives?
Yes, we do have the non-hormonal contraceptive. And just as I've mentioned earlier on, the non-hormonal contraceptive are the IUCDs. There are some IUCDs that are non-hormonal and there are others that are hormonals. When it comes to the IUCD that are non-hormonal, that is copper T, copper Y, and we also have the slick. Those are non-hormonals. How they work is that they do have, they are coated actually with copper. And that copper is the one that is having the effect of spermicidal, the spermicidal effect, in that it tends to kill the sperm. So you are unable to get pregnant with it. Yeah.
Okay. Okay. What can you do if the contraceptives containing progestin have side effects on you?
What I can tell you is that because it needs actually a process. It's a process that you'll have to undergo some things like tests. So I would advise that the person may visit the health facility so that she can be advised even more, because there could be some underlying causes of that side effect.
Okay.
Yeah.
Okay, and there's another one. I'm a first-time mom, and my partner does not want me to use family planning, and I'm afraid of getting pregnant at this period of nursing my baby. Any advice would be appreciated.
Yeah, that is why I also mentioned about now, those are now the hindrances, the challenges that we do face in the family planning field, in that the partners are the ones discouraging these mothers. But you get to understand that it is your right. For you as a woman, you need to be empowered. You need to take that risk and say, actually, it is me. It is not about any other person. This is about me and my family. So you need now to, if this partner is somebody who can understand, you as a woman, you need to sit him down, make him understand that actually there is the importance. This one, just get to know his fears. Why is he against this family planning? Could it be because it's a religious thing? Could it be because maybe he has been influenced by the friends? So you need also to find out the reason as to why this man is refusing. Maybe I'm scared to just mix from other people. You see, some just fear. Like, for example, I came across a question, does family planning cause cancer? You see, so maybe the same thing is running in the partner's head, that actually it causes cancer. That is why he fears that my wife can get cancer out of all these things. So you need to make him understand from your side. I can even give you a small story. Like, there's a woman at a health facility. She visited a health facility. She was put for an IUD. When she went home, the husband really complained. The husband was almost beating her because she was having this coil inside. So when she went to the hospital, back to the hospital, she explained this to the nurses and told them, please, my husband really wants this thing out, but for me, I know its importance. Please advise, what do I do? So you see what the nurses did? They decided, let us use this trick. So what they did, they dipped the coil, another coil, a new one, of course, in blood. And then they put on top of a dish. the theater dish, yeah? And then they called in the husband and told him, yeah, now we've removed it. We've removed it. This is the thing. So from today, you're okay. So for you to know that it's psychological, they told him, make sure you return the lady after like 1 week so that we see if at all the hormones have returned. You see, they didn't want to tell him that actually, in fact, the IUCD is a non-hormonal. So when they came back after 1 week, they asked, did you find any change? That, yeah. In fact, everything is okay. I didn't even feel the coil. In fact, you people, thank you so much. So you see, it is something that is psychological. So this man was thanking them, not knowing that the coil is still inside. You see, and the woman knew that the coil is still in situ. So sometimes it could be, it's something that is just psychological. Yeah.
Okay.
Thank you.
And can maybe the lady asking the husband or partner to accompany her to the clinic,
yes,
so that they both get advice? Can that help?
Yes, it can. Yes, it can. That one I advocate 100%.
Okay. And something else I'm thinking, maybe if he doesn't want her using hormonal or coil, could he use condoms maybe? Could the partner use condoms?
Yeah, and that is why I said, well, with condoms, if properly and consistently used. You know, sometimes why it tends to fail us, it's because maybe it was not put on well, appropriately, in accordance to the guidelines. Maybe this person did not even bother when checking on the sachet, the expiry date. Yeah. So you find such things are the ones that are causing the failure rate. But if properly used, this person could use even a condom. It's okay.
Okay. Haya, there's another question.
Yeah.
In Swahili, implant hufanya mtu asifeel mzee, as in akue amekauka huko ndani. That is one. Then coil inakuanga uchungu, I think uchungu kuweka ama kutolewa. Then juu coil nasikianga ni kachuma, does it rust? Na after kuweka coil mzee akiwa na can the man feel it? I think that's what she meant. Yeah.
Okay, good questions there. When you see the implant hufanya mtu asifeel mzee, that could be, I could say it's a yes, and again, it's a no. It depends with an individual, because you see, with implants, it's something that is hormonal. So the effect on you will be different on me, because some people, when they use the implant, they will remain the same. You get it? But others, some wengine wanakonda, the others kuna wenye wananona, there are others, when just inserted the implant, from day one up to the last on expiry, this person will remain the same, no change completely. There are others, their sex drive will even increase. In fact, atakuwa more active than the others. And then kuna mwingine naye will just behave like a pregnant woman, of course. That is now hormonal imbalance. How it reacts on you is totally different on how it will react on the other. Yeah. And then the other question was, then coil inakuwaga chungu kuwekwa. We don't use the term uchungu, but we use the term uncomfortable. So it's usually uncomfortable to use the coil, to insert the coil, because kuna some slight discomfort, not that painful as such. It's uncomfortable because it only takes like 5 to 10 minutes and you're done insertion. Okay. And then another thing, kutolewa is even much easier than the insertion. Then another question was that then juu coil nasikiaga ni chuma, does it rust? I can say it's not necessarily rust, but it does. What normally happens is that with coil, its effect when it comes in contact with sperm, as it comes out, you might see it as something like rusting, but actually it's not rusted. It's just the reaction between the sperm and the coil. Okay, so it does not rust as such, as per se, because
Okay.
rust only comes with water. And you see inside us, when there is in that uterus, it's the mucoid layer. Yeah.
Does family planning affect baby through breastfeeding?
It does not really. This question was quite ambiguous because does family planning affect baby through breastfeeding? How did this person want to put it? Was it that the effects to be seen on the baby, or I guess so, but
Especially on the baby.
it does not affect the baby. It only affects, maybe there are some people, they might be affected by the milk production. That used to be. With milk production, it tends to lower the milk production, but actually it does not affect the baby.
Okay.
Mm-hmm.
I'm a first-time mom. I would like to know the key things that I should look for before starting a family planning.
That's a good question. But I would like to know the key things that I should look for before starting a family planning. Actually, you need counseling. That is the first thing that you do. When you come to our facility, or when you visit any facility that is offering family planning services, you will be guided. You need to have one-on-one talk with the service provider, so that with that you are able to identify, because it's not just about family planning, when you come, like for example, when you visit our facility, it's not just about you picking a method and leaving. No, you'll be taken through all the methods. Then from there, when you decide, there are some tests that you will have to undergo, so that we see, are you actually fit for this specific method? Are you somebody that, when you put, for example, when we insert the coil, are you somebody that after 2 days you'll come back, coil imetoka? You see, we have to assess you. So those are the things, and that is the importance of you visiting a health facility before you decide. Okay? Yeah.
Okay. There's a question on Jadel. Two questions. I'll join them together.
Mm-hmm.
Can someone get pregnant when? How is Jadel? Can someone get pregnant when in it? What are the chances? And then the second question from a different person. What is the difference between Jadel and implant? Is it the same thing or they are two different things? What do they contain? Do they have any effects on breastfeeding of the baby?
Jadel is the one for 5 years. Jadel goes for 5 years. And the implanon, not the implant, because the implant is the general term for both Jadel and the implanon. The implanon goes for 3 years. And they are both hormonals. They are both inserted on the arm, in the arm, I mean. Yeah. Then what was the other question, please?
Can someone get pregnant what are the chances of getting pregnant when you're on Jadel? And I think, what does it contain? You've said, do they have any effect on breastfeeding of the baby?
Okay. Just as I've answered the above question, is that they don't have any effect on breastfeeding, only the milk production can be affected. And then when it comes to you getting pregnant with it, it's what we call failure rate. You see, nothing in this world is 100%. So we cannot say that nobody can get pregnant with it. It is among the 2%, and you could fall among the 2% or the 1%, yeah, of that failure rate.
Okay.
Yeah.
Okay, there's a hand up. Let me unmute. She asked her question. Okay, ask her. Okay, you can ask. Hi.
Hi.
Okay, thank you for giving me this chance. I wanted to ask if I can put implant on if I'm not on my periods, because according to my knowledge, I know when you go to put implant on, you're supposed to be on your periods so that they'll be sure you're not pregnant. And since I gave birth, I have not seen my periods. So my question is, if I want to put it, can they put it for me if I'm not on my periods, or if I have not yet seen my periods since I gave birth?
Yes.
Thank you.
Yes. That is a very good question. But you see, when you come to the facility, they have to carry out the pregnancy test. You see?
All right.
Yeah. So most of the facilities, they tell you, come when you're on your period so that they are sure, because they don't want you to incur other expenses like testing for pregnancy. But if you're somebody who can test for the test, who can go for the test, I don't see why you should be denied the chance, because actually you need to access these services. Yeah. So for me, I would tell you, if you come to me, I would test. If you are not pregnant, actually, I would give you the service.
Okay.
Yeah.
Okay.
Thank you.
You're most welcome.
Okay, another question. I'm using a 3-month injection for the first time, and I'm bleeding sana. What should I do now? Ndio nimemaliza 1 month saizi.
Yeah, just as I've answered the other questions, actually this lady needs to visit a health facility so that you can get more counseling, because with that one, it's hormonal imbalance. And you see, there are some things that there are some pills that you'll need to be given so that it balances the hormone. You see? Yeah. So for you, you need to visit a health facility so that you can get more counseling.
Okay.
Yeah.
Sawa. I use the 3-month injection na period zangu zimepotea. Is this okay? Ama itaniletea shida baadaye?
That is very okay, because I started by saying it prevents ovulation by not releasing the egg. You see, when the egg is not released, you will not see your menstrual flow, because how the menstrual flow functions is that when the egg has been released, it tends to move through the fallopian tube. It goes up to the fundus of the uterus, and then it rubs itself against that wall. That is if it does not find fertilization. And that is how you now experience the menses. But if the egg is not released, that means traveling through the fallopian tube won't take place. Rubbing on the fundus won't take place. So you end up missing the periods. That one is very normal. Yeah.
Okay. Which is the best family planning? Because I don't want to get fat.
If you don't want to get fat, it means that is something you'll go in for something that is non-hormonal, because we've said things that are hormonal, it can either affect you positively or negatively. It can either affect you in that you increase in weight, or it can affect you by reducing in weight, or you can remain the same, depending on you as an individual, how your body reacts towards this family planning. So if you don't want to get fat, then it means you are left with the option of only using the non-hormonal pill, the non-hormonal contraceptives, or even the barrier method, which is a condom. Yeah.
Okay, my baby is 2 months. Apart from Femiplan pills, which other is contraindicated? What are your costs?
Come again.
My baby is 2 months. Apart from Femiplan pills, which other is contraindicated? And what are the costs?
Okay, what this person needs to do, because we said there are some things that we normally check. So you cannot just be contraindicated without them assessing you to see the need of the family planning that is suitable for you. If at all they come across, if at all you come to the facility and then they realize that actually you have some contraindications on some certain family planning methods, of course they'll tell you you are contraindicated in using this, because you find somebody like somebody who has things like varicose veins, yeah, DVT, deep venous thrombosis, that is, this person is contraindicated from using any hormonal pills, any hormonal family planning. So you see, when it comes to contraindication, choosing the specific ones, you have to undergo counseling first so that you are advised appropriately.
Okay. How soon after delivery is it advisable to start using family planning?
Ideally, you are supposed to start after 6 weeks. When the baby starts coming for injection, the first injection of 6 weeks, that is when you also come for family planning. Why we do that is because most of the time we tell somebody that no, you can only practice the lactational amenorrhea and you will be fine. But you see, some of them, they don't do it the right way. You see, some of them, they practice mixed feeding, in that they breastfeed, at the same time, they give something. And you see, by doing so, you're interfering now with the hormones that are supposed to maintain you from getting and prevent you from getting pregnant. Because that time that you're feeding this baby, that is the time you're supposed to be breastfeeding. And yet you are giving food. So when you give food, it means the hormone tends to fluctuate. And when they start fluctuating, you get pregnant. So we normally advise mothers to come at 6 weeks. That is the most appropriate time to start family planning. Yeah.
Okay. Uh-huh. There's somebody saying here, mimi nilitumia implant ikanikondesha vibaya. Does it is it the implant what is it? Sheila.
Yeah. I started by saying actually how it will react on you will be totally different from another person. So you find it does not actually affect directly, it affects indirect, in that it affects the appetite, you see. So when this person tends to eat, anakula sana, that is when ana increase in weight. But kuna mwingine atakula sana, but the hormones imekataa, they are just tumekataa. So this mama will tend to conda even more. So how it will react on you will be totally different from another person.
Okay.
Yeah.
Are there effects in short-term family planning compared to the long-term? Are the calculations of the amount of milligrams in the 3-month injection compares to the, how are the calculation of the amount of milligrams in the 3 months injection compares to the long-term one? Okay.
Yeah, when it comes to the dosage, we have like, for example, the Cyanopress, it has 104 milligrams, you see. And when I give you the injection, it means the whole of it gets into the body at once. But when I give Jadel, it means the Jadel has 2 rods and one contains 75 milligrams. So with Jadel, it will release little by little, bit by bit, until the 75 milligrams are over for a period of 5 years. So you see, if there are any side effects, when it tends to have side effects, the side effects will be more visible with the 3 months injection than the implants. the long-term methods. Because with the long-term methods, they tend to be released little by little. Yeah.
Okay. Does the coil does
Yes.
it move? Huyu anauliza kama inaweza kusonga.
That is why, okay, sorry. That is why we normally advise mothers to come for checkup. Once they insert the coil, you need to come for checkup after 1 month, and then after 3 months, and then after 6 months, then yearly, up to a period when it will expire. So when we advise you to come back after 1 month, it means we want to assess with that coil, with your sexual activity, is it able to move? And if it can move, then we are able to see it from the strings, because with the strings, we normally cut at a reasonable size that it's visible, we are able to see. So when it moves, it means the cords will be too short, and we will realize that actually it has moved. And then we will realize that actually you're not the best candidate for it, and we will advise you accordingly. So yes, it does move at times.
Okay. So someone is asking about, I think, so is it sure when I breastfeed faithfully without giving the baby anything, I guess, I can't get pregnant? And how does it work without giving the baby anything?
If you breastfeed, every method we've said it's not 100%. There is a percentage yenye inakuaga the failure rate. But most of the time, if you breastfeed accordingly, it tends to maintain the progestin hormone at a certain level. This progestin hormone will continue to prevent you from getting pregnant. But once you start mixing with other feeds, it means then the progestin hormone will go up, will go down. And when it goes down, that is when now the estrogen comes up. And that is when you get pregnant. I don't know if I've answered the question.
Okay. Okay, so does family planning interfere with the days of period, and which is the best? Okay, I think you had answered that. Does it interfere with your menses? I think that's what she meant.
Yes, it does, because it causes hormonal imbalance in the body. Those are the hormonal methods. They do cause hormonal imbalance in the body. So it can interfere with your menses. Yeah.
Okay. So I'm done with the questions, and then unless we have more questions on my side, the questions are done. Ladies, do we have questions? Let me unmute. Let me unmute them. Ask to unmute. Just make. Hi.
Hi.
Kuna swali lingine? Is there mute all? Okay. Is there another question? If we don't have any question, okay. If you don't have question, before Sheila gives us her parting shot, I'd really like to appreciate Sheila. You came straight from work. Thank you so much to come and spend time with us. And I think the ladies and even me have learned a lot. So yes. Ladies, if you have a question, please ask, type, raise your hand. We ask as maybe Sheila gives us her parting shot. And I'm seeing a lot of people asking the cost. Sheila, the cost depends on where you are going, for the service.
Yeah.
Mm.
Actually, the cost will depend on the facility that you're visiting. They tend to vary. There is no specific.
Okay. So I'm saying, does Jadel, does it affect periods? I think you'd answer that, but I think she had gone out. I mean, she just came in again. Does Jadel, does it affect periods?
It does affect periods in that it's a hormonal contraceptive. Being that it's a hormonal contraceptive, it can tend to alter the menstrual flow. In that, with family planning, how it works, it thickens the mucus plug on the cervix by blocking the entry of sperms. It also prevents the ovulation by not releasing the egg, and then it thins the wall of the uterus by making it unfavorable for implantation. So you see, it tends to interfere with the menses in that it prevents the release of this egg traveling into the uterine cavity to cause the menses. Others, it tends to you will tend to bleed even more than twice. It means the egg has been released more than twice in a month, more than once in a month, I mean.
Hi, ladies, any question before we let Sheila to go and rest kidogo? Any more question? Or
Hello.
comment? Hello?
Okay, not a question, but I want to thank you for the teachings. Thank you.
You're most welcome.
Most welcome.
All right.
Patch method. What are the side effects?
That one, I would really lie when I say that patch method, I've come across it. For us, it has not yet reached our facility. But the disadvantage of it is that once exposed in the sunlight, that is it. It tends to release more of the hormones at once into the body. So you find that when it releases more hormones, they tend to finish from the patch itself. So with the time, you might be thinking it's protecting you when actually its protection elapsed long time ago. So you end up getting pregnant with it.
Wow.
But it's a hormonal thing. And we've talked about hormonals.
Good to know, because you can think you're protected and kumbe, there is no protection.
Yeah.
Okay, thank you so much, Sheila. I personally want to really thank you for taking your time. We've been getting a lot of questions on contraceptives and all that. Most moms some of them are first-time moms, and really a scary period. You want to be safe. You want to make sure you're not going to have 2 babies in 1 year. And which it happens, It happens.
Yeah.
Thank you so much for taking your time to come and talk to us.
You're most welcome.
Ladies, maybe what else would you want us to talk about next time? Is there any suggestion maybe from your side you'd want us to talk about the next chat?
Next time, okay, it must be just about family planning or any other topic.
No, anything else.
Okay, I'd like us to talk about breastfeeding. Yeah.
Breastfeeding, the challenges,
the milk supply. Yeah.
Okay. Sawa. We'll talk to Sheila if she can. If it's not her expertise, we can still try and see if to get someone else, but we'd be glad to talk about breastfeeding. How old is your baby?
My baby is 2 months.
2 months. Okay, yeah, we can talk about that, and even expressing and storing milk, because you will be going to work sometimes.
Yeah.
and how to prepare for that.
Thank you.
Okay, thank you so much for attending. I think we had a good number both on YouTube and Zoom. Once again, Sheila, thank you so much, and God bless you.
Amen. You're most welcome. It's my pleasure actually to serve you people, because nursing is not just a call. It's not just a profession, but it is a call. So even when you people invited me, actually, I really took it at heart and said, no, these mamas, they really need my help. So I'll stand in for them.
Wow.
Yeah.
Thank you. Thank you.
Thank you.
You're
Yeah,
most
actually, we do ask people, can you come and talk to moms? And the first thing they ask us, how much are you paying? And we tell them, actually, we're doing this to help. You know, we're actually doing this to help and assist mom, because then, you know, a mom who is assured,
Yeah.
she'll be able to take care of herself and her baby and her family. Yeah, so thank you so much, Sheila. I really appreciate.
You're most welcome.
Okay, take good care of yourself, yeah? In the
I will.
Yeah.
Yeah.
Hi, yes, thank you, ladies, and good night. Unless there's anyone want to say anything. Okay. Thank you so much, and good night.
Good night too.
Good night.
Good night.
Good night.
Good night.
Good night.
Good night.
Thank you.
Good night. I may now leave the group.
That's crazy. How? God, it hit me. Tired today. This is very good. Oh, I don't know if this. My goodness. God, I'm so hungry. Do you know? How? Hi, Sheila. Thank you. So ili imetoka. Let's say thank you, Jesus. It didn't hurt me. Oh, God bless you. being ignorant. Imagine. I guess she's this I don't. Stood for 2 hours. I don't even have time to talk to her.